Thank you for staying. Now, COVID-19 and its impact on the educational sector, specifically teachers, is where we go to now. And 75.7% of respondents mention that COVID-19 has had a severe psychological effect on them. They talk about financial, emotional, and social areas in which they've been affected, in which the pandemic has impacted them. So how do these teachers get out of this situation? We're joined now by Dr. Eugene Dodoy. He's a clinical psychologist and lecturer with the University of Health and Allied Sciences. Peter Anti as well. He is Executive Director, Institute for Education Studies. Gentlemen, thank you so much for joining us.
Thank you for having us.
Great. Let me start with you, Peter Anti. What is it that got you, getting into this drive or exploring this angle to get the survey, the results that you've actually pieced together?
Thank you very much. Good morning to your viewers.
Mr. Anti, I don't know.
Yes.
I'm hearing something in the background. So I don't know whether you have your TV or something on, or maybe alternatively, Dr. Dodoy, if you happen to have your TV on, please turn it off so we can avoid the static or the feedback. Thank you. Peter Anti, you can go on.
Okay. All right. Thank you very much. We observed during the period of the pandemic that...
All right, so we shall try to get this rectified so we can get the proper understanding of what is being said so that the sound would not be echoing like we hear. Peter, can you hear me?
I can hear you very well.
Okay, so Dr. Dodoy, I suspect there might be some gadget on somewhere that you might be.
Is it better now?
I think it's somewhat better. Great.
Okay.
So Peter, please go ahead.
Yeah, so we observed that there's been a lot of focus on the students during this period of the pandemic, and we realized that a little attention or no attention has been given to the teacher. So as part of our research activities, we decided to zoom into the life of the Ghanaian teacher and find out how they are coping with the stress and anxiety that has characterized the COVID pandemic. So we sent out almost 5,000 questionnaires to 10 regions in the country and across 80 districts, and we got almost 4,480 responses back. We analyzed the results and we are putting out the findings today. And prominent among in the research that we realized was that most of the teachers, as you indicated in your introduction, 75% and above, have indicated forcefully that the pandemic has had a psychological toll on them. And this is very, very important because we need our teachers to have a certain kind of stability of mind to be able to take care of our children. So if they are stressed and if they are very anxious, then it's not going to augur well for us in terms of the delivery of the content that they are supposed to deliver for our children. Again, a lot of empirical works have shown that stress has a negative impact on the teacher's productivity. So at the end of the day, we are so much interested in promoting learning outcomes, and that is what the ministry is pushing. That's what Ghana Education Service is pushing. We want students to perform well in their academic work. We want students to deliver, to be able to be useful to the society. But those who are supposed to deliver the content, those who are supposed to push and direct students are having a lot of psychological trauma during this pandemic, and we have not been able to institute any kind of psychosocial support for them. Then it means that our efforts to enable our students to access quality, equitable and inclusive education would come to naught because they will not be able to deliver the kind of support systems that they are supposed to do for the students because they themselves are not in the right frame of mind to do that. We also looked at the differences in terms of stress level between the males and the females, and we realized that the females are having a lot of stress as compared to the males. In terms of location, those in the urban centers had a lot of stress on them and anxiety as compared to those in the rural and peri-urban areas. Again, in terms of levels, teachers who were teaching in the primary and then junior high school level recorded a higher level of stress and anxiety as compared to those in the senior high school level. And one of the striking reasons given for teachers at the primary level was that they had to think through how they will be able to deliver the lessons daily because of the absence of requisite teaching learning resources, especially the textbook issues that we have been talking about. They also make mention of infrastructural challenges, and some of them also talked about how supervisors, I mean, what we now call school inspectors, interact with them when they come to school. They think that those interactions put a lot of stress on them. We also realize that teachers have realized students have lost a lot of learning, what we call learning loss. And in their estimation, it will take between 1 to 6 months to be able to recover some of the extent of learning loss that have been recorded in the life of the student. So basically, our report was now to throw light on the Ghanaian teacher to see what they are going through, and also profile recommendations to enable the authorities help the teacher in these times of the pandemic. And interestingly, we woke up this morning to realize that Achimota has recorded almost 135 COVID cases. And these include teachers and students. Now you will see that the focus will be on the students, and teachers will not be talked about. And that is exactly the essence of the research work that we did.
Right, and it's very interesting, the note on which you've ended. There's one member of the staff who has succumbed to COVID-19, at least as we know it. But you've mentioned as well in that research piece, Spain, China, and countries in the Arab region doing more in terms of teachers. So you feel that it is high time we moved away, not just from a focus on students, but also a focus on teachers, from what I gather. But let me quickly move on to Dr. Dodoe for a quick bit on the stress levels. Per the research, 35.2% are saying they've suffered severe levels of stress. Over 25% of the respondents are stating that their levels of anxiety have increased. And interestingly, very curious, 57.1% mentioned that they have not received any form of psychosocial report. This happens to be a problem that we have all the time. Any surprises in there, Doc, that the levels are so high of those who are feeling stressed, those who feel that their stress levels have increased, and those who are not getting any support at all on the psychosocial level?
Yeah, thank you very much. I think that there are no surprises at all. And in fact, some of us expected the percentages or the values to be a bit higher than we are seeing. What we usually, if you look at the health sector, the health workers who work directly with patients who are suffering COVID, they themselves had a lot of anxiety and depressive issues. So if we look at people like teachers, these are people who have chosen a vocation that they work with other people. They want to help other people realize their dreams and stuff like that. So for them, the work they do is not just a work, but also it gives some fulfillment that, yes, I have achieved something. And for all of us, if we are frustrated in achieving our goal, all of us become stressed. So, I mean, what is in the environment? So we have the environment, the time, and the place. So people, place, and time that affects your productivity, or that frustrates you from achieving your goal, largely will be also responsible for making you, become stressed. So the environment will stress you up. So what we see here are people who want to impact children, and then we are getting them not getting that environment conducive to do the work they do. So essentially what we are saying is that, or what is happening to them is that they do not get that sense of fulfillment. I mean, forget about the salary and everything. Teachers get a lot of fulfillment from realizing that their impact has improved children's life, their quality of life, their thinking and everything. So when that is not there, they are likely to get frustrated. And I can't say something literally that when you cannot afford to give anything to your in-law, you don't also rob them or you don't steal from them. Unfortunately, that is what we seem to be doing to our teachers. They are through no fault of theirs. This like COVID came, and now technically their job was very much affected because students were not in school. They have like prepared to teach them and all that. So that joy, that fulfillment they were going to get has been taken away from them. So we expect them to be anxious, to have anxiety levels, to have high stress levels. Some of them might even get a clinical depression because they are not getting that. And then not only that has happened, the students came back. They were expected to do more than what they were doing formally, because now they've missed some period. They're supposed to teach and catch up. And there's a new syllabus, there's a new thing altogether, which has no textbooks at all. And that, makes it worse. So I don't know what we expected from them, but this probably didn't capture the actual trend.
Right.
It is expected to be a bit much higher than what we are seeing now.
Okay.
The worst of all is the fact that we are not providing them any psychosocial support. And this is something that, now organizations and unions are realizing. So the police is doing something about it. They are providing psychosocial support to their own and all that. So teachers group especially, the employer has a duty to actually provide them with that psychosocial support, knowing very much that the stressor is there. Now, we all know an identifiable stressor. So we expect them to be stressed. And unfortunately, we are not there for them. We are not, we are expecting them to be there for our children, but we are not there for them, unfortunately, and which is, quite disheartening. And in fact, that will be a vicious cycle that more of them are going to feel that, well, nobody likes me. Let me talk a bit about the male-female. So normally we expect anxiety and depression levels higher in women than men.
And that was something, Doc. That was something I was about to get into before I get to your own. But is there any, on the psychological plane, is there anything accounting for that significant increase in the stress levels of women as compared to men? Could there be anything that can explain that?
Yeah. So generally, when people are stressed, they respond to overcome the stress. They respond to be able to do something about the stress. So many women naturally will tend to express their anxiety and stress levels or depressive levels. Men find, unfortunately, unhealthy ways of solving that problem. They will start drinking. Problem. They will start in a bad behavior like betting or gaming. They may start to, very few people will choose a healthy one, like maybe learning a new skill. But largely, so if we take substance abuse or alcohol and drug abuse levels, we'll realize that a significant number of the men would have that problem compared to the women, because the men drink their problems off whilst the women express their symptoms. And that is why we see that significant difference in, the male and female.
Okay, I'm going to pose this question to both of you, but I'll start with Peter and T. You are in the sector, you are a teacher of sorts. What would you say the impact of COVID-19 has been on you personally? I mean, you sampled some 4,480 people across these 3 months, but what is your personal story? Is it reflective of the research?
Yes, it's been stressful. The fear of contracting the disease and then taking it to your family and them the possibility of spreading it across your family and to your friends is the greatest issue here, because you are still interacting with the students. You are supposed to interact with the students, and you are supposed to assist them. You are supposed to mark their scripts, and you are supposed to also talk to them. And the tenets of the virus is said that you need to practice some of these social distancing protocols. You are supposed to clean your hands intermittently. You are supposed to put on nose masks, which sometimes even block your ability to project your voice during instructional period. So those kind of challenges, it's there, and it puts a lot of pressure on you as a teacher. But if you are looking at the other teachers, and from the reports that we put across, we realize specifically with the primary school level, their ability to control class is a big issue for them, because students at the senior high school levels, that's why when you look at the stress levels for the various teachers, you will see that those at the senior high school level had a little level of stress as compared to those in the primary school level, because they indicated to us that it is difficult to control them and to ensure that they are practicing the social distances, they are not touching each other, and they are not doing all those things. So those kind of issues was very prominent in the responses that they were giving us. Again, you will also realize that they have gone through a new curriculum. They were trained to go and implement it. Then, right few months into the term or the semester, they have been asked to go home. Now they have been called back to continue what they were supposed to teach, and there is the issue of no textbooks. The issue of students have forgotten what they have already taught them. The issue of them trying to help students recover. All those things brought a lot of stress on the teachers. And I want to make a point about the male-female issue. One of the issues that came us forcefully was the fact that in the school system, most of the students tend to go to the female teachers more than the male teachers, because they see the female teachers as mother figures. So in all challenges and issues, the female teachers are brought forward than the male teachers, and that increased the level of stress on them, because the anxiety is, if you are coming to me, what is the likelihood that I'm going to contract the disease, and then I'll be taking it home for my family to also contract it. So those are issues that increase the stress level for the females as compared to the males.
All right, interesting point you make. When I come back to you after speaking with Dr. Dodoy on the same point, I'll be looking at some of the proposals you've made on the back of this, including the Ghana Health, the Ghana Education Service, focusing more on the welfare of teachers. But Dr. Dodoy, what has been your own lived experience when it comes to this matter we are discussing, the psychological, social, economic impact of COVID-19 on you as a lecturer?
Yeah, I mean, it's interesting. We're not seen as teachers. I don't know why we are called lecturers, but we are also teachers, and it's very much affected a lot of us, because we are not only teaching, and unfortunately, some of us we teach medicine. So I'm a psychiatrist, and I teach mental health. So the challenge was that when other doctors, other teachers get the condition, they fall on you to psychologically help them. So the just as Peter was talking about. So unfortunately, some of us even do not get access to the services that we provide to others. So for me, as a lecturer and as a psychiatrist, the biggest challenge was not only myself getting the infection, but my students getting their infection, my colleagues getting their infection, and the parents of the students, how to manage them. So we had a lot of them. Luckily, UHAS had a very good, so we formed a response team for the faculty and a response team for the students. And there was clear guidelines on what to do if a student suspects they have infection. Right. And if a faculty suspect they have infection. And then in the School of Medicine where I teach, we actually sent out daily surveys to the students to assess their stress levels and to find out if they have any concerns of getting infected. Because unfortunately for us, we cannot hold all our lectures on internet, on Zoom or something like that, because students will need to see the patient, right, talk to the patient, examine the patient. So they came into very close contact, and definitely some of them got the infection, and then their parents were worried. So sometimes we have to leave the students and to manage their parents. Wow. And when faculty had the infection, a lot of their families were worried and all that. So yes, we got the infection as well. Our students got the infections, and then unfortunately for us, we have to manage our colleagues and our students who get the infection. So it was, it is very stressful. Right. But again, that is why the psychosocial support is very necessary.
And the point to be made is that
many people could fall back on us, and we assisted them. The same way, even us too, we learn to get help. So we, as a faculty of mental health in Ghana, we also supported each other throughout this period, and we continue to do so. So it's very important that people realize when there's a stressor, that, if you are going through such thing, you are definitely going to be affected one way or the other, and know where to seek help. And we are not many, but currently, we have a lot of people who have been trained who can provide that support. And it's very important we make use of that support.
The interesting takeaway from that is you guys have been providing, specifically have been providing certain services to people, but on the same level, you may not be getting that kind of response or help when you need it. But to wrap the conversation, Peter Anti, let's talk about, in the next minute, let's talk about some of the proposals you've put forward in terms of boosting the welfare of teachers, per your report. What can you share with us? Peter Anti, are you still with us? Hello, Mr. Anti. Hello, Mr. Anti, can you hear me? Well, we're trying to reconnect with Peter Anti, Executive Director, Institute for Education Studies. Peter Anti, can you hear me now? Right. It's unfortunate that at this juncture, Peter Anti's connection is not operating like we would have wanted it to, but they also come out with a number of proposals moving forward in terms of dealing with this menace or this situation where teachers are going through a lot of psychological and other forms of issues that need to be dealt with. And one of them has to do with the education sector actually focusing on the welfare of these teachers to ensure that they are taken care of psychologically, not just physically, not just financially, but that the psychological help is also brought to bear. Let me wrap with you, Dr. Dodoy. So moving forward, what would be your final comments on this matter in a minute, sir?
Yeah, I mean, I would like to encourage the labor unions to demand that their employers have what we call employee assistance program.
Hello.
So employee assistance programs basically what it does is that it's have an HR policy such that when people are stressed, when people are using alcohol and drugs, somebody identifies it early and then we intervene. So there should be somebody in the facility, in the organization, to be able to identify people, or people can go to them when they have these psychosocial challenges,
Right.
and then provide that, so that person in the organization will be the link between the psychosocial services and the employees who suffer same. So this should be something that HR people should be implementing. And if they are not doing it, the labor unions are supposed to demand it, that it should be there for them. We are doing something for our students, but it's not enough. And I think it's very important that we have something in school that helps students with.
Well, thank you very much, Dr. Dodoi. Let's also wrap with you, Peter Anti. Can you hear me now, Peter?
Yes, I can hear you.
Which I mean is good, but not enough. And this replicated on all institutions where students get help. That they need, that's social support, and we provide same for the teachers. And let's not forget the non-teaching staff. They also go through similar challenges, and we should be there for them to support them.
Peter, Dr. Dodoi.
Yeah.
Thank you for that point that you've made, and that's how we're wrapping. But Peter Anti, I'll give you a minute. Succinctly paint for us the picture. What are the proposals you've put forward? Continuous professional development, welfare. In not more than a minute, let's quickly take a look at some of what you're proffering.
Thank you very much. So we realize that support systems comes from the family, friends, and then basically religious institutions, which means that the employers are not doing much for the teachers. So we are saying that the Ghana Education Service and Ministry of Education should put in measures to support teachers, and especially the teacher unions. There should be measures to also support them. We should also look at how we are practicing this kind of continuous professional development day, which there's one day that
Unfortunately, well, we've lost Peter again, but thank you very much for joining the conversation, Peter Anti, of course, with IFEST, and Dr. Eugene Dodoi of the University of Health and Allied Sciences. We move on now, and the discourse focuses on improving Ghana's maritime industry, and the Ghana Navy is hosting the International Maritime Defense and Exhibition Conference. More on that when we return from the break.